Stop. Before you accept that a nursing home is your next chapter. Before you believe weakness, pain, and dependency are just part of aging. Before you let your health drift so far that you lose control of your own life. Pause, breathe, and listen. Protect your independence now before weakness forces dependence later is not just a warning. It is a wake-up call to recognize how valuable your strength, mobility, memory, confidence, and daily abilities truly are. Independence is something most people only fully appreciate when they begin to lose it. But the truth is that the choices you make today are constantly shaping whether you will remain strong and capable or slowly drift toward relying on others for the simplest tasks. When you ignore pain, fatigue, stiffness, or weakness, you are not just ignoring discomfort. You are allowing your future freedom to slip away a little at a time. Independence is built from everyday actions: how you move, what you eat, how much you rest, how you manage stress, how you care for your body, and whether you take your health seriously before it becomes an emergency. The body tries to warn you early with small signals, but too many people brush them off until those signals turn into limitations they cannot escape. Strength is something you build long before you desperately need it. Balance is something you train before you lose it and fall. Heart health is something you protect before you struggle to climb simple stairs. Joint health is something you maintain before every step becomes painful. Energy is something you preserve before constant exhaustion becomes your normal state. Independence does not suddenly disappear overnight. It usually fades slowly because people wait too long to take responsibility for their health. When you decide to protect your independence now, you are choosing courage, discipline, and self-respect. It means you move your body even when it feels easier to sit. It means you nourish yourself instead of feeding your body things that drain it. It means staying hydrated, sleeping enough, and managing stress instead of letting it quietly tear your health apart. It means addressing problems early by seeking advice, doing checkups, and being proactive instead of pretending everything is fine while your strength slowly disappears. Independence is deeply connected to mindset as well. When you believe aging automatically equals weakness, disability, and decline, you stop trying. But when you believe you can remain active, capable, and vibrant, you fight for your health. The people who stay independent longest are not always the youngest or the luckiest. They are usually the ones who made health a priority before they were forced to. They understand that the price of laziness, neglect, and delay is often paid later with pain, medication, and dependence on others for things they once did effortlessly. There is also an emotional side to independence. Being able to walk on your own, care for yourself, make your own choices, and live without constant assistance protects dignity and confidence. It allows you to enjoy your family without feeling like a burden. It lets you participate in life instead of watching it from the sidelines. It keeps your spirit strong because your body supports your will. Losing independence can feel like losing control over your own story, and that is why acting early is so important. Protecting your independence is an act of love for your future self, for the people who care about you, and for the life you still want to experience. Every healthy choice you make is an investment in strength, clarity, and freedom. Every step you take now is a step away from dependence later, and every effort you make today quietly builds the foundation of how you will live in the years ahead. Small daily health choices today prevent nursing home decisions tomorrow because the future of your independence is quietly shaped by what you do repeatedly, not by a single dramatic change. Every day, you choose whether to strengthen your body or neglect it, whether to nourish your cells or slowly wear them down, whether to move or remain still, whether to listen to what your body needs or ignore it until it forces you to pay attention. Many people think decline happens suddenly, but most of the time it is a slow process built from years of poor habits, skipped self-care, and the belief that health can be fixed later. The truth is that later often becomes too late. Choosing to walk instead of sitting all day, choosing water instead of constant sugary drinks, choosing nutrient-rich food instead of empty calories, choosing to stretch, maintain balance, and build strength are not small acts. They are powerful insurance policies for your future independence. These habits strengthen your muscles so they can carry you, support your joints so they can move freely, protect your heart so it continues beating strong, and preserve your brain health so your mind remains sharp. A body that is cared for daily is far more capable of fighting illness, recovering from setbacks, and resisting the physical decline that eventually pushes many people toward nursing homes. Small decisions also protect your mobility. Strong legs, flexible joints, and steady balance do not appear magically in old age. They are built through consistent effort over years. A few minutes of walking, some time spent standing instead of sitting, simple exercises that challenge your stability, and stretching your body to keep it flexible all protect you from falls, weakness, and immobility that often lead to hospitalization and long-term care. When you keep your body active, you are training it to support you, to respond when you need strength, and to remain dependable as you age. On the other hand, inactivity slowly teaches your body to stop trying. Muscles weaken, bones lose strength, lungs lose capacity, and the heart loses endurance. And over time, that weakness demands help from others because the body can no longer handle daily life on its own. Daily health choices also include mental and emotional care. Stress, worry, loneliness, and constant pressure damage the body more than people realize. Taking time to relax, laugh, connect with loved ones, stimulate your brain, and nurture your emotional health strengthens not just the mind, but also the body. Chronic stress raises blood pressure, weakens immunity, increases inflammation, and accelerates aging, while a calm and supported mind helps keep the body resilient. Sleep is another crucial daily choice because every night your body repairs, restores, and heals. When you consistently neglect sleep, you weaken your systems, reduce energy, cloud your thinking, and push yourself closer to health problems that eventually require medical and assisted care. Nutrition is one of the most powerful daily choices. What you feed your body either builds it or breaks it. Fresh foods, fiber, healthy fats, protein, and hydration help organs function, keep blood sugar stable, protect the heart, support the brain, and maintain energy. Over time, these choices reduce the risk of disease, disability, and dependency, while poor eating quietly pushes health toward medication, weakness, and reliance on others. Prevention is always easier than treatment, and it happens through daily commitment, not occasional effort. When you realize that every choice you make is either moving you closer to independence or closer to dependence, you begin to respect your body differently and care for it with intention, discipline, and awareness. Strengthen your body, sharpen your mind, and support your heart before decline begins means understanding that your health is not something to react to only when problems appear. It is something you build every single day long before crises force you to pay attention. Your body is your lifelong partner, and every move you make either strengthens it or weakens it. When you choose regular movement, even in simple forms like walking, stretching, light strength exercises, or daily physical activity, you are teaching your muscles to stay capable, your bones to stay strong, and your joints to stay mobile. When you neglect movement, stiffness grows silently, strength disappears gradually, and daily tasks that once felt effortless start to feel heavy. Building physical strength now keeps you independent, protects you from falls, allows you to handle daily life without relying on others, and gives you confidence because your body supports you instead of limiting you. Physical strength is not about looking athletic, it is about remaining capable enough to carry your own life. Sharpening your mind is just as important because independence is not only physical, it is deeply mental. A sharp mind remembers, plans, makes decisions, learns new things, enjoys conversations, and stays emotionally alive. When you engage your brain daily through reading, learning, thinking, solving, communicating, and staying curious, you give your brain the exercise it needs to stay healthy. The brain weakens when it is ignored, just like muscles weaken when they are not used. Mental stimulation helps memory stay stronger, reaction time quicker, and emotional resilience steadier. Protecting your brain also means managing stress, sleeping well, and giving yourself time to breathe because constant tension damages cognitive health over time. A calm, stimulated, and rested mind is more capable of staying independent, handling challenges, and maintaining dignity as you age. Supporting your heart goes beyond emotional symbolism. It is literal life protection. Your heart works nonstop from the moment you are born, and how you treat it determines how well it supports you later. Nutrition, movement, stress management, sleep, and regular health checks play a powerful role in keeping your heart strong. When you choose healthier food, control excessive salt and unhealthy fats, stay hydrated, and maintain healthy weight and blood pressure, you are giving your heart relief. When you remain active, you train your heart to stay efficient and resilient. When you ignore your heart's needs, silent problems often grow unnoticed until they become serious. Supporting your heart also means supporting your emotional life, because loneliness, sadness, anger, and constant stress take a real physical toll on cardiovascular health. A loved heart is a healthier heart. All three, body, mind, and heart, are deeply connected. If your body weakens, your mind becomes discouraged. If your mind weakens, your motivation fades. If your heart weakens, everything slows down. But when you care for all three together, you create a powerful foundation for long-term independence. The earlier you begin, the greater your protection, because decline often begins far sooner than people expect, quietly and slowly, until one day simple actions feel difficult. Acting early means respecting your future, valuing your independence, and refusing to wait until problems become too big to control. Strength, clarity, and vitality are not accidents. They are built intentionally through consistent, caring choices you make for yourself every day. Aging is natural, but losing control of your life is not. Act early reminds you that while growing older is something no one can escape, surrendering your independence, freedom, and ability to live life on your own terms is not something you are meant to accept passively. Aging is simply the passage of time, but decline is often the result of neglect, delay, and the belief that health can always be fixed later. Many people confuse aging with weakening, forgetting, slowing down, and becoming dependent, but much of that happens not because years pass, but because people wait too long to take care of themselves. Your body gives you warnings through tiredness, shortness of breath, joint pain, stiffness, balance problems, or mental fog, and each of those signals is an opportunity to act before they become limitations. Acting early means respecting these signs instead of ignoring them, strengthening your body instead of allowing it to weaken, nourishing your health instead of constantly draining it, and valuing your independence before it is threatened. When you act early, you give yourself power over your future rather than letting circumstances decide for you. Strength, stability, memory, heart function, and overall vitality are not suddenly lost in one day. They usually fade slowly, year after year, in people who tell themselves they will start caring for their health soon. That soon keeps getting delayed until walking is difficult, energy is gone, medications pile up, and help from others becomes necessary. Acting early breaks that cycle. It means you stretch and move before your body stiffens permanently. It means you strengthen your legs before standing up becomes a struggle. It means you care for your heart long before disease forces you into treatment. It means you protect your brain before forgetfulness becomes frightening. It means you take your health seriously not because you are old, but because you want to stay capable as you age. Losing control of your life does not only mean physical dependence, it also means emotional and psychological loss of confidence. When your health declines, your world becomes smaller. You avoid going out, you hesitate to climb stairs, you fear falling, you rely on others, and slowly your identity changes from someone who lives freely to someone who constantly manages limitations. This affects your dignity, your happiness, your sense of purpose, and even your relationships. Acting early helps you protect not just your body, but your spirit. It lets you stay involved, enjoy activities, socialize, laugh more, and stay engaged with life instead of feeling like an observer. Aging can be graceful when health is respected because you remain connected to your strength, your independence, and your confidence. Acting early also means accepting responsibility instead of blaming age for everything. It means you stop saying, "This is just old age," when your body is really asking you to care for it better. It means you take preventive care seriously, get checkups, monitor your health markers, and address issues immediately instead of waiting for emergencies. It means you prioritize sleep, hydration, balanced nutrition, stress control, and regular movement because these simple disciplines protect you far more than any late treatment ever can. It also means nurturing emotional wellness, staying mentally active, building positive habits, surrounding yourself with support, and refusing to let fear or laziness control your choices. Age may change your appearance, slow your pace slightly, and add wisdom to your life, but it should not steal your control, your independence, or your right to live fully when you choose to act early and care for yourself with intention and commitment. Choose prevention, strength, and self-care now to secure a healthier future means realizing that the quality of your later years is being built quietly by the habits, attitudes, and actions you choose today. Prevention is not just a medical term, it is a powerful life strategy. It means stepping ahead of problems before they trap you, taking responsibility before crisis forces you, and valuing your health enough to protect it while you still have control. Preventive choices like regular movement, nutritious eating, staying hydrated, sleeping well, and managing stress may seem ordinary, but they create extraordinary protection for your independence. When you prevent disease instead of only treating it, you reduce the chances of chronic illness, disability, and dependence on others. Prevention means you listen to your body when it whispers, so you never have to face it screaming. It means checkups, awareness, and paying attention to health markers not out of fear, but out of respect for the life you still want to live. Strength is another pillar of a secure future. Strength is not only about muscles, it is about building a body that can carry you, support you, and stay dependable as you age. Strong legs reduce the risk of falls. Strong muscles protect your joints. A strong core supports your back and balance. Strength training even supports brain function and emotional resilience. When you build strength now, you give your future self protection against the weakness that forces many people into assisted living environments. Without strength, even simple tasks like standing up, walking, climbing stairs, or carrying groceries can become overwhelming. With strength, you maintain the freedom to move, to explore, to participate fully in life. Strength is an investment in dignity because it allows you to care for yourself longer without constantly needing help for everyday things. Self-care ties these choices together because it is the mindset behind every healthy action. Self-care is not selfish. It is a declaration that your health matters. It means you treat your body kindly instead of punishing it, you give yourself rest instead of constant exhaustion, you choose healing foods over harmful habits, and you make time to care for your emotional and mental well-being. Self-care includes movement, but also includes emotional boundaries, peace, laughter, relationships, and purpose. It involves avoiding destructive routines, managing stress before it breaks you, and allowing yourself to slow down when your body needs recovery. Many people only start caring for themselves after something goes terribly wrong. Practicing self-care now means you honor your health before it reaches a breaking point. When prevention, strength, and self-care come together, they form a shield around your future. They reduce the likelihood of losing independence, needing constant supervision, or being placed somewhere simply because your body can no longer support you. They help protect your heart from disease, your mind from decline, your bones from weakness, your joints from pain, and your spirit from feeling powerless. They also protect your relationships because instead of feeling like a burden, you remain someone who contributes, participates, and inspires others by how well you care for yourself. These choices are not dramatic. They are daily. They are simple. They are consistent. And they quietly build a future where your life remains in your hands instead of being dictated by weakness, illness, or avoidable decline.